Always great to have our next guest here with us, Dr. Ronald Lederman. He's the orthopedic surgeon and sports medicine doctor over for the Center of Orthopedics and Sports Medicine. Welcome back, Doc. How are you?
I'm great. Thank you for having me. How are you?
We're surviving. If it maybe about 70 degrees warmer, it would be better.
I was just snowshoeing last night in about 15 degrees. And as long as you're moving and active and generating the heat, it's amazing out there in the crisp air.
It's pretty to look at from the inside, but do you use the heated jackets and the heated vest?
I've got heated gloves, and I've learned through my biking with my group that if you layer up, you can stay warm. Obviously, in these really cold temperatures, you have to layer up. You want to get the hand and toe warmers, and you want to be very careful with any exposed area of the body.
So I have a story for you about the toe warmers. You'll like this one. I was covering, it was like some hockey game at U of M a few years ago on New Year's Day. I forget who was playing, but it was so cold that I put toe warmers and hand warmers, obviously I was using, but the toe warmers, and yes, I had 2 pairs of socks. I put them in between, but it was so cold outside because you were stuck outside for hours that I ended up with second-degree burns on the bottom of my feet, but they were so numb, I couldn't feel them getting so hot from the toe warmers.
Those are very effective toe warmers. Wow.
Right? They were just the dollar ones, and everyone's like, you're not supposed to put them directly on your feet. I'm like, I didn't. I had socks on, but that first layer of socks, they were thinner. And so, but yeah, I learned my lesson on that one. And of course, my doctor, he thought I was crazy when I went in and I said, hey, doc, I think I burnt the bottom of my feet. So with that, though, as you were just saying, I know the last time we had you on, we talked a lot about some of the injuries that we can sustain and how to keep ourselves safe in the cold winter months and watching out for the ice and things like that. But today we want to really talk to you more about stem cells. And this is really a fascinating area of medicine. For those, break it down to us, the very basics. What are stem cells?
Stem cells are very specialized cells that have the ability to differentiate into what they're needed. So on the regeneration front, if you can get a stem cell to grow new cartilage, theoretically you'd have the cure for arthritis. If you can get stem cells to regrow new pancreas cells, you'd have the cure for diabetes. So stem cells is still experimental, and we're still a long ways off from growing a new heart or pancreas or even cartilage. But I will tell you, our experience at Lederman-Kwartowitz Orthopedics has been incredible. And it's more of we started it as a regenerative medicine program, hoping that the studies in the laboratory on animals that showed growth of new cartilage would grow new cartilage in any of us that could minimize the effects of arthritis. Arthritis hurts, and it affects quality of life in a nutshell. And every day I go into work, and every day Dr. Kwartowitz and Dr. O'Keefe and all of the doctors at Lederman-Kwartowitz, we see people that are hurting. And the good news is, way more often than not, we can do things that help people with their pain. The regenerative stem cell program we started 2.5 years ago, we started with the hope of growing new cartilage in a younger person, 20, 30, 40 years old, that had cartilage damage in their knee, in their shoulder, wherever it may be. And what we discovered is that we can't really prove that it's growing new cartilage, but almost every single patient that we injected these stem cell type materials into just about every joint got, if not complete, then significant pain relief. It has been a game changer for people that really want relief without having to go through a big surgery.
I remember years ago when Michigan was passing the law to allow for stem cell research. What is the controversy surrounding this arena of medicine?
That's a great question. To do stem cell research, you are typically harvesting very young embryonic cells from either an embryo, maybe an aborted fetus. You can imagine the controversy that creates, and it goes so far beyond our discussion today. But here's the beauty. The stem cells and the material that we are injecting into our patients is from the donated tissue after a healthy newborn delivery of either the umbilical cord or from the amniotic tissue of the placenta. So it's donated by the mother after they've had a healthy newborn delivery. So there's no real controversy there. And then this tissue, there's a handful of quality companies around the country that prepare this tissue, and it's expensive, unfortunately, but it comes to us in a little vial that we actually put in a deep liquid nitrogen freeze right there in our office. So when people come to Lederman-Kwartowitz Orthopedics and they say, hey, I heard about this regenerative program or stem cell, my knee, my shoulder, my hip, my ankle is killing me, I don't want surgery, or I'm not healthy enough to have surgery, we can do it the same day. We'll evaluate them, take x-rays, and see if we believe it would help. And interestingly enough, as I mentioned a few minutes ago, that we thought this was going to be for the young athlete that had an injury and had a small little area of cartilage damage, because we went into this thinking we can maybe regrow new cartilage. Maybe. We can't promise or guarantee anything. But as we saw the pain relief for arthritic joints, or the accelerated healing of Achilles tendonitis and tennis elbow and other tendon issues, we started getting older patients, and I mean in the 80s and 90s, that have god-awful arthritis. They're not healthy enough to have surgery. They're coming and getting these injections, and they're coming back a month later, 2 months later, asking for the other knee or the other hip or the other shoulder, because they cannot believe how much their quality of life has improved, because they can now walk again. They don't have the pain the debilitating pain they were experiencing. It's very exciting.
So what is the recovery time? And is this something, once you have one injection, do you have to keep coming back?
So we don't know that yet. I can tell you we started this program about 2.5 years ago. Now, personally, I had 20 years ago a bad ski injury, and I got slammed into the mountain. My shoulder dislocated, it popped back in, and I never had surgery on the shoulder, but over the next few years, the pain was horrible. This shoulder pain kept me awake. I couldn't sleep on this side. It would wake me up 3, 4, 5 times a night. It affected my quality of life so dramatically. And I actually was the first patient to get my stem cell injection in my office 2.5 years ago. I couldn't move my arm before, and now I can sleep on my shoulder. I'm back to doing push-ups, and it's been remarkable. So when we found that, it's an injection in the office that we use ultrasound guidance for, so we know exactly where we want to put it. We want every drop of this liquid gold to get where it needs to get, and there's no recovery. I was back to doing whatever I was doing, but it will take anywhere from 4 to 8 weeks for the pain relief to kick in. Whether I'm growing new cartilage in my shoulder or not, I don't know. My x-rays do show arthritis, and that's why I got the injection. Hold off the arthritis, maybe not need a shoulder replacement in 5 or 10 years. But I have such amazing function, and I can do everything I want to do. I think less about new cartilage growth and more about all the things I can do again.
So what needs to happen to make this more mainstream and also more affordable?
I wish I knew the answer. You know, when you're dealing with insurance companies, and I'm sure you have friends that, you know, doctors are notorious about complaining about the pressures of Blue Cross, and they keep, you know, reimbursing less and making it more difficult. I mean, we all had to go out and buy electronic medical records, and to do that, you need software and licensing fees, and it just increases the cost of just running a practice when all you want to do is help people. And then, of course, Medicare, they do the same thing, so that's government. You know, I don't know the answer to that, Ronnie. My hope is that when enough people get benefit from this, then it will create a bit of a groundswell of support and reaching out to your congressperson, senators to say, this needs to be covered.
It really does, because you're looking at, in the long run, saving money as well, because if you can avoid those surgeries, that's
So
going to be better for the patient.
that's a really good point, and that's probably the key point. The studies now have to show that long term, 5, 10, 15 years down the road, it actually alters the course of the disease. That's called arthritis, the disease here. And I will say this, as I sit here, I can't assure or promise someone that their bone-on-bone arthritis won't still need a knee or a hip or a shoulder replacement in 5 or 10 years. But one thing I can say with certainty after all the experience we've had is you're going to hurt a lot less, you're going to do a lot more, you're going to have a lot more quality of life. And so here's my question. For someone that wants to kick the can down the road a little bit, is that worth it to them? And the prevailing answer is absolutely yes. And I think even the people making the decisions at Blue Cross or Medicare or the politicians might say, we can't approve it because we can't guarantee you won't need the joint replacement. But every one of them would come in and want to get one if they can feel great for 2 years or 4 years or 6 years.
Most definitely. What do you think the future of this is?
It's only going to improve. It's going to get better. Like anything with research, the brain power behind all of this is remarkable. Just like the vaccines. Who thought we could have gotten a safe vaccine within months and not years? And I hope you've gotten vaccine, although you're way too young probably. But me and everyone in our office, just about everyone at Lederman-Kwartowitz Orthopedics has gotten vaccinated. It is safe. People need to do that. That's a little sidebar. I'm done with that soapbox. But to answer your question, the research will continue and it will show that it benefits people. To what degree? Only until you get millions of people that you really tell. But right now in our small little study at Lederman-Kwartowitz Orthopedics, 95+% of patients are so happy with the results that they're telling family and friends, and it's safe. There's been no side effect. So, we will continue to offer this to people that have any interest in non-surgical, dramatic pain relief of their arthritis or tendons. I might have mentioned earlier, Achilles tendonitis often can lead to a rupture. Then you're talking about surgery and you're hobbling for up to a year. We've been doing these injections into Achilles, avoiding the rupture, showing MRIs of complete restoration of normal Achilles tissue without surgery and without any significant downtime. So I think it's cutting edge technology and cutting edge medicine for orthopedics.
The medical world really is fascinating. But if you were able to get the shot, is there a physical therapy program that goes along with it? Or is it just the shot in the arm or wherever you need it and then you're on your way?
I am a huge believer in physical therapy. We have on-site physical therapy at Lederman-Kwartowitz right there in the Lakes Medical Center. And actually, we are just within a week or two opening up a satellite location further east for our patients that come from even Clinton Township. So we're going to have an office at 13 Mile and Telegraph, which will make it easier for the greater metro area. But physical therapy for treatment for any tendonitis or arthritis, I think is critical. For an arthritic joint, you work on improved range of motion and you want to strengthen the muscles around that joint, which can act as shock absorbers to take pressure off the arthritic joint. So to answer your question, when we do a stem cell regenerative type treatment into a joint, always physical therapy, and our therapists on site there at LKO know exactly what to do. And the same thing if somebody ends up needing surgery. We're big believers in pre-op therapy, which is called prehab. Now, the literature has shown that that's beneficial, so insurance companies have actually approved prehab. And then you want to do post-op physical therapy very aggressively as well.
So what about could this help with people with frozen shoulder and some of those other issues like that?
Absolutely. Frozen shoulder is an enigma. We don't really know why people get it, other than it can be as simple as just they tweaked their shoulder, they slept on it funny, they babied it for a week or so, and it started freezing in that position. Physical therapy is huge for that. Cortisone injections have been shown beneficial, but we've also done PRP, which is the plasma-rich protein. Now that's not stem cell, but PRP is where we draw blood from our patients, we spin it down in a centrifuge, and then we're left with this plasma-rich protein mix, which does have some regenerative properties, and we are able to inject those into shoulders, hips, knees, and some people are more comfortable with that because it's their own tissue.
Yeah, that kind of makes sense. But when we're talking about injections, what size needle are we talking about here? I'm a baby when it comes to needles.
Everybody is kind of a baby. I'll admit to it as well. Who wants a big needle? So when we started investing in on-site ultrasound units, we put our ultrasound probe, just like you get when, with the baby, when someone's pregnant, right around the joint. It helps us direct the injection right where it needs to go, which allows us to use a really tiny 25 gauge needle. Most patients don't even feel our injections, and they can't believe how easy it is at our office.
Little needles I can handle.
Well, they're tiny. And you know what? Just as for current events here, 12 years ago, Tom Brady made PRP popular by getting plasma-rich protein of his own into his Achilles tendonitis. It was 12 years ago. He was a baby. He was 31 years old. But, he's a miracle doing what he's done for so long. But there is a lot of validity to the plasma-rich protein regenerative type injections and the stem cell regenerative type injections. And we're going to keep offering it to our patients because we believe very strongly it helps a lot of people.
What do you think the future of this is?
I think the future is that it will become more recognized, but there are a lot of treatments that people have done considered alternative medicine that they've done for 10, 15, 20 years, and it's still not approved by insurance. And that's the big thing, who can afford these treatments and who can't. And for people that really need it and can't afford it, we work very hard to make it as affordable as possible for everyone. But it's just not there yet for insurance to cover it across the board. People can pay for these treatments with their healthcare, their HSA accounts or flexible spending accounts, which helps. So we're trying to do everything we can to make it affordable and easy enough for everyone or anyone to get it.
But it really is fascinating, the research that's going into this and the advancements in the medical world. And it's great to have people such as yourself knowledgeable in these arenas and these areas to be able to offer the services to the public. Doc, anything we didn't touch on that you want to share before we say goodbye to you today?
We're still offering the MLS laser, which we've done for about 6 years. We've treated over 3,200 patients. We've kept track of every patient and every diagnosis. And the most common diagnoses are injuries, sprains, arthritis, tendonitis. And we're still running a 91.5% success rate with the laser. It's a robotic laser technology that's in our physical therapy. So for patients to kill two birds with one stone, they get their on-site physical therapy with the laser treatment. And, our goal is to get people better faster and to get them better without having to undergo surgery. It's exactly what I would want my own family members to get. And that's what we offer to everyone.
And that's great. We're lucky to have you here in our community. Again, I know you just mentioned you guys are expanding 13 in Telegraph area. When do you expect that to open?
Hopefully within a week or two. And we should have all that information on our website at lkorthopedics.com. So LK Orthopedics spelled the easy way, orthopedics with a PEDICS. But we just want to reach as many people as possible.
Wow. Thank you again for being with us, and good luck with the expansion. And also the fascinating industry with the stem cell. And let's hope that it does become more widely available so that the insurance companies will start covering it.
Well, hopefully they're listening to you as well. I agree with you.
We're going to
Thank you for having me.